Module 1. Health is central to how older people experience growing older. Every older person has the right to health and the access to health services to support them in being able to contribute doing the things they value for as long as possible. This module examined healthy aging, highlighted barriers to healthy aging for older people, including for older refugees and older people with disabilities, reviewed non-communicable diseases and mental health which impact healthy aging, and presented the role of health services in promoting healthy aging. Healthy aging, as defined by the World Health Organization, is the process of developing and maintaining the functional ability that enables well-being in older age and ensures the continued ability to meet basic needs, learn, grow, and make decisions, be mobile, build and maintain relationships, and contribute to society. Healthy aging is not random, and individual characteristics such as genetics, lifestyle behavior, interact with environmental characteristics to impact healthy aging outcomes. Barriers to healthy aging are typically related to ageism, accessibility of neighborhood and services, lack of older people's involvement, and gender inequalities. For older refugees, displacement challenges healthy aging because of limited access to age-appropriate service, limited expertise about aging among humanitarian staff, interruption of essential medical treatments, loss of access to necessary support, and risk of psychosocial needs resulting from the instability and insecurity of the situation. Healthy aging is at risk when older people experience poor physical health and functional abilities. Non-communicable diseases are diseases long duration that require regular medical care, which can impact function and health, are a leading cause of deaths worldwide, and are common in later life. It's important for humanitarian organizations to recognize the role of NCDs on healthy aging outcomes, as these diseases can lead to disabilities and increase the support needs for older refugees. Older refugees with NCDs can be at greater risk of NCD health complications because of limited access to necessary medical treatment, interrupted monitoring of chronic diseases, and poor quality living environments that can exacerbate health conditions. To name a few examples, mental health in later life can also challenge healthy aging, but it's often under-identified or under-diagnosed among older people. Depression and dementia are common in later life. Risk factors in later life of developing mental health disorders such as depression include the decline in functional ability, difficult life events such as bereavement, stress, and uncertainty of physical health conditions, and elder abuse and neglect. For older refugees, a humanitarian crisis and displacement introduce additional risk for developing a mental health disorder or exacerbates pre-existing mental health challenges. Underlying the discussion about healthy aging is the recognition of the right of older people to health and the importance of healthcare access. Healthcare services should be equitable in access, high quality, safe, effective, participatory, and efficient. However, barriers to healthcare exist, and attention must be given by humanitarian actors as what barriers must impact older people's right to healthcare. Older people face healthcare barriers related to ageism, lack of awareness and knowledge among healthcare professionals about health conditions common in older age, and challenges in accessing care due to age and gender discrimination. All of these barriers can be compounded by humanitarian crisis and displacement. Barriers can be overcome with better knowledge about aging, gathered through disaggregated data on age, gender, and disability. as well as improved participation of older people in their health care. Person-centered care is an approach to care that strives to do this by placing the patient, not the disease, at the center of the health system in order to empower individuals to be active participants and in charge of their health care planning. Person-centered care must be better developed within humanitarian settings because of the barriers older refugees face in obtaining needed healthcare services. By doing all this, we can help to ensure that the rights and access to healthcare of older people, including older refugees, are met, and that all have the opportunity to experience healthy aging.